Good morning, this is Patty Marquez at the Oncology Clinic. I'm requesting a transfer of a patient to the ED. MX is a 74-year-old female presented today to the outpatient clinic for scheduled immunotherapy infusion. Patient has a history of advanced lung cancer. The daughter reports the patient has become increasingly lethargic, puffy, and confused over the past 48 hours. Contributing factors: a recent TSH of 49 from 1.49 weeks ago. Participating stressors: recent upper respiratory infection noted last week with active advanced non-small cell lung cancer treatment of pembrolizumab Keytruda every 3 weeks, 200 milligrams IV. Current symptoms: the patient has altered mental status, alert, awake, and oriented ×1, only 2 person. Patient is awake but rather frantic. Classic non-pitting edema or myxedema noted in periorbital region and cheeks and bilateral hands. Skin is cold, pale, and dry. Respirations are shallow. Vital signs: 42 breaths per minute. Blood pressure is 85/54 manually. Temperature is 94.2 auxiliary. Respirations 8. Blood glucose was 58, and O2 sats were 89% on room air. Physical findings: macroglossia. Assumed diagnosis is myxedema coma, secondary to adverse effects from immunotherapy and systemic stressors. Treatments and interventions currently at the clinic: started patient on 2 liters of oxygen via nasal cannula. Saturation has improved to 93%. Peripheral IV on left forearm, 24 gauge. Started normal saline bolus of 500 mL. Applied warm blankets. Patient drank half a cup of orange juice so far. Patient is at risk for further respiratory depression. Transfer is requested via ambulance to nearest emergency department with the ICU.